Hi everyone, thanks for joining. We're going to get started now. Just a reminder, 30 minutes, one question, one follow-up. Today we have Dr. Williams and Dr. Yaffe here, so I'll turn it over to them for some brief remarks.
Right. Well, good afternoon. And I hope everybody had a good weekend, at least half the weekend, since one day was quite nice, the other day was quite blustery. And so hopefully everybody was safe and not too much any damage in that, and power outages have been corrected. So as usual, we have our data for over the weekend, and to comment on that as well as I'll give some comments. So as the pattern is, I'll give over to Dr. Yaffe to talk about our data and some of the information there for over the weekend.
Okay, thank you. Thank you, Dr. Williams. For the last 4 days, Ontario has recorded over 1,200 new cases of COVID-19 per day, with a record high of 1,581 new cases on Saturday. The 7-day average is now 1,443 cases, and this is up from 1,106 1 week ago and 919 cases 2 weeks ago. Most of the cases reported over the last few days, approximately 75% of them, are concentrated in those regions that are now in the red level: Toronto, Peel, York, Hamilton, and Halton. But we are seeing elevated numbers in other jurisdictions, and we continue to closely review the data as we make decisions this week on which level our public health units will be in. In terms of testing, we have seen some improvement in recent days. Our positivity rate has been slowly declining from a second wave high of 5.7% last Tuesday, and our testing volumes have remained fairly high. Since last Friday, we've processed an average of 40,226 tests per day, with a positivity rate of 4.2%. Today, there are 500 people in hospital, with 125 patients in ICU. That is up from 367 people in hospital and 84 patients in ICU only 1 week ago. Tragically, we have also seen an increase in the number of deaths from COVID-19, and we want to offer our sincere condolences to everyone impacted. I'll now turn it over to Dr. Williams for a few remarks.
So the trends are concerning, not only here in Ontario, but across most of Canada, with the exception of the East Coast. We're having some cases, but not anywhere near what the rest are experiencing. We are continually trying to get those numbers down. And as we said last week, we did announce the new framework and the lowered trigger numbers in there. So all those came into effect at midnight or first thing this morning, except for Toronto, which was on Friday. And then Peel had moved already from the red to the continue in the red, and they had been in that place already before. And so most of those numbers, as Dr. Yaffe would indicate there, that have been in the areas of Toronto, Peel, York, and to some extent Ottawa, not so much. And so they cover at least 1,000 of those cases that we're seeing there. And so the work is cut out, and we have to work on that one. But again, the challenges for all Ontarians as we try to get these numbers down, as I talked about last week when I was with the Premier, that if we all do what we're supposed to do and do it well and do it consistently and keep at that, we can get these numbers down as we did before and bring them down to levels so you move from the red to the orange, the yellow, and I would like to think everybody would be in green, especially before the time of Christmas. So it's there. It's not easy. It is a challenge. It's one that people are struggling with to maintain, to keep to do and do consistently. The simple message of staying home when you're ill, keep your distance from those that are not in your household, wear a mask and wash your hands frequently. But as well, we've asked some stipulations in some of the different zones, and we're looking at how to decrease that, especially the ones in the red and the orange zone, to really look at where some of the recommendations that both the Medical Officer of Health in Peel and in Toronto come out with, asking to limit people in the household visits, keep it to that number, just your ones who reside with on a regular basis, and to take those extra precautions. We're still seeing that when you have those large amount of community cases, the overflow, much like we see the cases overflowing from the younger age groups, and younger can be up to 20 to 49, into the other age groups, and then into those over 80 over time, and some of the younger children, you also see it flowing into the long-term care facilities in those areas a lot more because it's being brought in from outside. And you also see it impacting on the number of children that are showing up and some of the staff at schools that result in a lot more work to do the follow-up on those cases there and to keep vigilant on our protection systems around our long-term care facilities, as well as our other congregate settings and school system to keep them up and open and running. So, so we have our task ahead of us. We are watching to see what happens with these new targets in there, and some we will be reviewing those as we do, and then to make some recommendations if there's any change in the numbers, especially as some health units are progressing up. As we said before with our framework, when you go up for a period of time. So we try to go up as quickly as we need to address rapid changes in the positive cases. But we come down more slower to allow to make sure we cover the 1 and 2 incubation periods to be assured that it's just not going up and down quickly, which is even more disconcerting for the public as well as for business and retail store owners. So those are the general comments there. And with that, we'll open up for questions from the media.
We'll go to the phone lines. Just a reminder, 1 question, 1 follow-up. Over to the first question, please.
From Haley Cooper, News Talk 1010.
Thank you very much. Dr. Williams, Premier Ford said on Friday that he's asked for you to review any potential further restrictions and that you would come back this week with any advice. So when do you expect to have that report ready for the Premier? Is it already completed? When can we expect to hear those details?
It'll be coming later in the week. We have a cycle to work with both that and with the cabinet in the time frames to give that, because there has to be changes in the ROA that deal with some regulations. Then that would have to be brought to first to the minister and then to the Premier and then to the cabinet for decision making, usually by the middle Thursday or sometime this week for decision making. So we're trying to get into a timeline so that we can get the pattern of recommendations, not only if there's changes to health units in the status that they're in the framework, but also any other ones that you're alluding to there that deal with any further restrictions that may be merited and required at this time for consideration for advice to the Premier and then to the cabinet for their decision.
Follow-up?
Thank you. My follow-up, it seems like every doctor in the province has a different opinion on how to tackle this pandemic, and a lot of them are on the radio or in the newspapers or in front of TV cameras almost daily, criticizing every move you and the province has been making. So how difficult is it to block out all those extra opinions and focus on the science and focus on doing what your experience tells you is the right approach based on the evidence at hand?
Well, it's a good question. And I guess, first of all, when I do hear the voices and I hear the comments, I see it from different perspectives. Some are taking a view from where they see it, from their narrow one, that this is really important and they would like this listened to. They're frustrated if it's not being dealt with in particular because they feel the pressure and the issues on hand and they feel it's something they need to say. At the same time, it's often, you'll see there's different ones, and they'll often be contradictory to each other. Why? Because when you see things from different areas, you have a different perspective on that. And with physicians in general, having worked in the physician community many years, when you get a bunch of physicians in the room and you have a discussion about a case management, it's not always in agreement, very rarely, and everybody has strong opinions of how they feel from it, from their own area and their area specialty. At the same time, I understand the COVID fatigue and the feelings of frustration, and sometimes those comments move from being evidence-based to being ones of personal and feelings of, I guess, upset, anger on different commentary. My challenge, of course, our challenge here is that we listen to all the different voices. We're dealing with population health. That means the wide overall population. And if you take some measures and do some and not pay attention to the others, there are consequences. And even when we have our discussions among physicians, you take that approach, then there's this side effect and that side effect. It will deal with this one, but you cause problems this way. And the same as we have economic impacts, we have health, mental health impacts, we have social impacts, equity impacts. All these are important to weigh in on that, because I may see it I'd like to choose it simply someone from their perspective, but we have to see the wide approach and bring that to the table. So I hear the ones, and I try to sift out through some of the commentary, personal issues and stuff like that to say, is there some real valuable, is there good messaging still in there? And what should I take from that? So don't automatically just dispel it. Say behind those sometimes angry comments or some comments, there is a good point to be made that needs to be considered.
Next question.
From Jeff Gray at the Globe and Mail.
Oh, hi. Thank you. I wanted to ask Dr. Williams about just picking up on Haley's point about thresholds for the next step in a red zone, thresholds for a lockdown. Will there be any sort of benchmark published, or what's your thinking on that, and why don't we sort of maybe have that spelled out so people know what's coming?
Yes, on the framework, as you know, we have the thresholds for the color zones, and then you saw to the right the gray, the so-called lockdown zone. And we hadn't had enough time for our experts to look at that and ask about, because lockdown means many things to different people. And in fairness, there are different types of lockdowns. And so you want to define, one, what is the evidence to support doing that action at this time? What are the consequences of doing that action at this time? Are there severe consequences? Are they minor consequences? But what's the benefits, and to weigh those out and to make sure you move on them. And like, for example, the one I mentioned last week, do you lock down with schools open? Do you lock down with schools closed? It makes a big difference. And both are lockdowns. Do you lock down every type of facility? Do you lock down any visitation to long-term care homes? We know already the impacts on that. Do you lock down in some areas or wide areas? And if there's not a need for a province-wide, if it needs to be in surgical, they use that term, I'm not sure it's a good term, but if it's very localized, is that a reasonable approach? Is it an unreasonable approach? So there's a lot of points to put in there that may not be an automatic trigger, and because when you're asking and recommending up to the Premier and to the Cabinet, they also have to weigh all those things into account, because as Cabinet ministers, they have province-wide, government-wide responsibilities and duties to make those decisions. So there's many parts to come in there, and so we're hoping to give as best advice as we can to deal with the issue at hand with the circumstance we find at this time in order to get the best result and try to minimize the consequences we can. But of course, our target is always, how do we prevent mortality and morbidity as best we can in COVID and in other issues as well.
And just to follow up, I think I asked you this some time ago when it came up before, but it's come up again today with the Toronto Board of Health asking that the advice that you give or the advice that you get from the public health measures table, the other tables, that be made public before the government and cabinet decide on it. Can you explain maybe, is that anything wrong with that idea? Do you like that idea?
Generally in government due process, when I'm given information material advice to me, I give it to the minister and to the Premier. That advice, because it's going towards a cabinet decision, has to be kept confidential at that time, because the cabinet has to be know that they are dealing with it as it's given to them without other materials on there, and they're going to make a decision on that. So that's just part of government due process, because it is going towards a regulation change under either the original EMCPA or the Emergency Measures and Civil Protection Act, or the ROA, the current version of that. So we have to honor that due process in that methodology.
Next question, and this will be the last question unless anyone else joins the line.
From Randall Denley, The National Post.
Hi, my question is about retail. We don't hear too much about it anymore. I just wonder what information you have on retail as a source of infection.
Was that retail? Retail
Yes,
centers. Thank you. Well, we have we continue to watch all our outbreaks and case contact management. We do have some retail centers that have been found to be a center for a locus for infection with a spreader at that site. They're hard to monitor because there's usually, by the history of retail, there's always people moving in and moving out. And we're more concerned about the internal congregate one where people are there for a period of time and not wearing their mask. And as originally when we had the modified 2 levels, we were trying to go after those ones. Even there, if you can imagine, in a restaurant for a period of time, while you may be there for your meal for an hour and a half, whatever, there's a lot of people going and coming all during that time. And then, in fact, if you get ill, was it on this night or was it the person on that one and this one? So the case contact management becomes more difficult, but we have records of retail, gymnasiums, other congregate settings, unfortunately still large social gatherings, some of them in centers, and some related to places of congregate, like with houses of worship and that. So we have a variety of them. What you see most of the time is that our most sensitive indicators of any outbreaks, because they're set really low, is our long-term care homes, which right now our definition is just 1 case, and a lot of them are mostly under investigation, and same with our schools. So that's why they look like they're bigger. But in essence, they may be only the end product of a case transmission, not the source of it inside until we declare an outbreak in those facilities. So the retail one there, difficult to document, but our sense is that quite a few are doing what they need to do. And the public in most places are wearing masks inside, as they're supposed to if it's like a store. But there are some concerns I heard recently about we had some rules before about malls, and sometimes on malls and that, especially the weather's getting colder, there's a lot of people in there, not in the retail store per se, with sometimes no mask, the mask hanging on the front of their chin, not falling things, and very crowded. So we have to look at the changing venue of those and making sure if we're going to target things, it's with the right target, with the right center, and not curtailing good behavior, but making sure that we are trying to limit improper behavior to limit spread.
The feedback I'm getting from workers in big box stores, as well as consumers, is that some retailers are getting pretty lax. They're not making sure people bother with hand sanitizing, distancing. Things are pretty much as they were pre-pandemic. Places are crowded, rules aren't being followed. Who's it up to enforce that?
Well, because Dr. Yaffe does with all the outbreaks, I'll let Dr. Yaffe answer that question.
Thanks. Yes, certainly workplaces are under the Ministry of Labor. And so if the staff are concerned, they should be contacting the Ministry of Labor, or the local health department can go in and investigate. Certainly there is, as we know, COVID fatigue, and it's hard to remember to do all these things, and it varies. I certainly know that Dr. Lowe put out a Section 22 order under the Health Protection and Promotion Act in Peel with respect to workplaces, I think. Because he obviously had heard that there were issues with compliance. So I think sometimes it's actually the workers that end up with the infections, not the clients, because the workers are there all day, and they are the ones who see the problems most often. I just want to add, in terms of Dr. Williams' comment around outbreaks in retail, it's important to keep in mind that only about 10% of the cases in total are associated with outbreaks. So there are many cases where we may not identify, because of the number of cases there are for investigation, we may not know where the person got it. It's hard to say, the person walked through a mall, but they went here, they went there. It could have been anywhere. But it's just, everybody has to remember that any time you interact with other people who are outside of the people you live with, that's where the potential for transmission is. So it's important to keep wearing that mask, washing your hands, and try to stay 2 meters away from people. So it can happen in a retail store, it can happen in a mall, it can happen anywhere.
Next question.
Cynthia Mulligan at City News.
Hello, doctors. Toronto Public Health today revealed that the positivity rate is higher for students who are 14 to 17 years old than any other age group. They stand at 7.5%. Is that a concern for you? What does that say to you?
So I'll have a comment, and then probably Dr. Yaffe has a comment. We see this shifting because Toronto originally was in the slightly older age group, young people. in there. What we're seeing, which is concerning to me, is that some of the behavior, especially in I would call the older high school age students who have probably a lot more freedom in that to move around, some are not adhering to the protection and the standards in there and are congregating in activities. So it is concerning that that's happening. One is that it should be preventable. And second, because they are accessing the school system, it adds an extra hazard to not only the older high school students, but also to all the students. So again, we're all important here, and even if I watch the JKs and SKs really putting on their mask and being very careful, and they're quite particular about it. I know some of my young grandchildren give me a lecture, make sure I know all the facts. I like to hear them, and thank you. It's just like echoing coming back, and they're pretty particular about it. But I think that means the older students have the same responsibility because they are young adults. And the young adults are not that different than the young adults that were causing Toronto's major transmission just 6 to 8 weeks ago. So any comments from Dr. Yaffe further on that?
Sure. Certainly that's a high rate, 7.5% positive. I'd like to see the trend over time. Is this a one-time blip? Nevertheless, and also to look at how many people are in that age group are actually getting tested. And are we reaching enough kids, people in that age group to actually find out what's going on? Obviously, there's the issues of non-compliance, and that is an age group that probably, would like to, see friends, get together with people, and so on. And so we just need to look at the data and keep looking at the message. And I know that there's a lot of work happening around social media and trying to get the message out in different ways to that age group that probably doesn't relate particularly well to Dr. Williams and myself.
Follow-up?
We are seeing cases, though, rise in schools in general. Are you concerned? And listen, I know I think the last time I checked, it was 13% of schools had cases. Are you concerned that it is slowly creeping up?
Why don't you start? Because you're on the committee.
I'm on the committee. So, as I always like to say, what's happening in our schools is a reflection of what's happening in the community. So, as we're seeing more transmission of COVID-19 in the community, by nature, we see more of it in the schools. The good news is that we're not seeing much evidence of transmission within the schools. So once cases are identified, the measures that are put in place have been very effective in controlling that transmission.
Last question.
From Brianna Carnegie,
Global News Radio 640. Thank you for taking my questions. They're for our upcoming feature series on long-term care. Dr. Williams, what steps are being taken or need to be taken to get more staff into long-term care homes and to keep them safe as we continue to see the number of COVID-19 cases and deaths rise amid the second wave?
Well, I'll start with a couple of comments. I know that Dr. Yaffe is on the long-term care incident management committee as they deal with this really challenging issue. I think you've identified a good point. One is the human health resources, the staffing in these locations to make sure that, they stay healthy. And that's why we did change the directive and making sure they had access to all the different types of PPE that they feel they need to be safe. And again, we're very concerned that in the areas where there's a lot of community transmission, it means some of them are actually susceptible to getting infected out in the community too. And so we're worried for them on both grounds there and try to ensure there's the adequate staffing in place. And a number of steps have been taken by the Ministry of Long-Term Care along with our Ontario Health partners to try and work with those issues. And so I'm going to ask maybe Dr. Yaffe has a few more comments to make in regard to those points.
Yeah, again, as the level of community transmission goes up, inevitably the infections are happening in long-term care and other congregate settings. And unfortunately, in those settings, the infection transmits and spreads quite quickly. A very vulnerable population. There are very big challenges with the staffing. Human health and human resources are very challenging for that particular setting. I know that there's work happening to train people, perhaps not to be PSWs, but healthcare aides, and these things unfortunately do take time. The other thing is, as Dr. Williams mentioned, more access to training and protective equipment, personal protective equipment, screening, active screening, testing. And so I know that Ministry of Long-Term Care recommends testing every staff person every 2 weeks. And if there's an outbreak, which is identified as one case in a long-term care facility, so it's extremely sensitive, we recommend everybody in the whole place get tested. So it's as proactive as possible. We know a lot of the issues with long-term care have to do with the structural issues. They're old buildings. They have ward rooms with 4 beds. So if somebody's been in a hospital, we do not permit them to be readmitted to a room with more than 2 people in it. Are we going to fix all the issues in long-term care right now? No, but we have to work on them. There's staffing, and there's another big one is infection prevention and control. And we are matching up long-term care facilities with hospitals and giving the hospitals extra resources to work with them on infection prevention and control, and making sure that, sometimes you don't know what you don't know. And there are important things like, even if the staff carpool, that's something where they can actually be infecting each other. But of course they have to get to work. And then there's, what do you do during the breaks when you take off your mask to eat? So all sorts of what seem like little details that can actually be a cause of a spark of an outbreak. So there's lots of work happening at the incident management table I sit on. We go through every outbreak that's happening in a long-term care facility and what can be done to control it as soon as possible. It's an ongoing challenge.
Follow-up, and this is the last question.
Thank you. And my follow-up is a question for my colleague, Dave Woodard. Dr. Williams, the Minister of Long-Term Care, Marilee Fullerton, said a couple weeks ago they should have allowed essential caregivers back into long-term care and nursing homes sooner. So why didn't you move sooner to allow essential caregivers back into the home?
So, that's a point that people asked a long time ago. I said, really asking for the Ministry of Long-Term Care to look at their visitation policies, how we can deal with that, because there are, just like we talked about with lockdowns and issues, that when you limit, there are consequences. We want to make sure you can remedy those. And we're strongly recommending in some ways to try and to deal with that. And I think there was a movement to put in place that we could get essential visitors defined, to have them tested so that they would be as consistent in their behavior to not expose themselves outside the home, just like Dr. Yaffe alluded to the staff, etc. And because of their concern and dedication and love and compassion for their loved one inside, we're limiting their own lifestyles and behavior to make sure they are not going to be the cause of that infection being introduced into the home, into their loved one in that center. So I think that was a good step in that way, and that's why, even if you're asking if we went and moved with more restrictions, I would like to think that we would not limit essential visitors, but we'd have to be very careful that they are being monitored, because if they're essential visitors coming from where there's high community spread, they're even more susceptible. And that means maybe they're going to have to even be more and more careful with their personal behavior in order to maintain their role, very critical role in my mind, of being that essential visitor on a go-forward basis to deal with those other aspects that I think are very important for these vulnerable individuals in these institutions.
Thanks, everyone.